Chairman, thank you very much. I'm very glad to be here. Looking forward to do this talk and to get questions for you. As the chairman said, the topic of my talk is metabolic needs in or of the ICU patient. I have no conflicts of interest. If you want to read about this, you can read the PACT module on clinical nutrition. It is a little bit outdated on some points. Hopefully it will be revised in the coming year, I hope so. Then you can go to the SICM website to watch or to look at the flash conferences on nutrition, different names, Griffiths, Werneman, Berger, Pichard. And you can also go to Darren Halan's website, criticalcarenutrition.com. We want to believe that there is an increasing focus on nutrition, both concerning the energy target and composition. In my opinion, nutrition should be prioritized on third place after airway, ventilation, and circulation in the critically ill patient. But what is the status in 2014? This is a survey made by Halan called The Prevalence of Iatrogenic Underfeeding in the Nutritionally At-Risk Critically Ill Patient. This is a survey comprising 3,390 patients from 201 units in 26 countries. Each unit contributed with 20 patients to this survey. The length of stay in this population were more than 4 days, and they were nutriated for more than 4 days. And look here, only 61.2% of the prescribed calories were received. Further enteral feeding started after approximately 40 hours. Is that good? Is it bad? And only 74% of the patients, or 74% of the patients received less than 80% of the target, the estimated target. Why is that? Do we have too much to do? Or is it so that nutrition isn't fancy enough? Or are we ignorant? We do not know how to do it. This means that education is very important, to educate ourselves and our fellows on how to do nutrition in the ICU. Patient goals from intensive care is first and foremost to survive. We have to stabilize the vital functions. Then the patient has to get out of the hospital and to get his or her life back. We can do something positive here by trying to save muscle mass and to rehabilitate muscle mass when muscle mass is lost. And we can do something with giving the patient targeted nutrition and to mobilize the patient, to give physiotherapy and get the patient out of bed. This is an old study from my department, published in 2003. They looked upon 136 patients and investigated their weight loss during the intensive care stay. And 70% of the patients lost between 5 and more than 15 kilograms of weight during the ICU stay. And this was not dependent on length of stay or time on the ventilator. A case. This is a female, 48 years of age, with a high BMI. She had a gastric sleeve operation, complicated with gastrointestinal sepsis. She was on the ventilator, she had a cardiac arrest, and her situation was critical. She was enterally fed to the small intestine, and she had also extra glutamine. Here we looked at the losses of urea in her urine. And if you